In Creston, in terms of problems with primary care, the number one is that at the moment we don't have enough physiotherapists. That in a smaller community, it's very easy to lose one or two people and then not have enough allied health members for that community, and that's what we're facing right now. In addition to that, we have a huge number of orphan patients. So patients without a family doctor, they have to go to the emergency department for every visit, and it puts a real strain on the system and on those patients. We've really focused on recruitment. Even prior to some of the incentives that came through with the GPSC, we had worked with the town to hire a recruiter, and she has been actively recruiting for several years now and has been very successful in bringing new physicians to Creston, and we really see that as the answer to a lot of our trouble with orphan patients. So another strategy that we've looked at through the GP for Me program has been enabling doctors to take on more patients on their own, and that's primarily been through making their practices more efficient, both with the use of allied health workers and also through some of our practice facilitation. I personally am most excited about the GP for Me program because I feel that it's made me more efficient, and when I'm more efficient I can take on more patients, I can feel better about my practice. And in our situation, it's because we've hired a social worker, and she's able to do great things with the patients, get things accomplished that I never could in my day-to-day interventions with those patients. And so for me personally, it's very satisfying to see people who have largely been marginalized be able to access a number of things they couldn't otherwise do. In Creston, when I look at healthcare change, the biggest thing that I see is that we need to work more collaboratively throughout our whole community. We're such a small community that anything that one clinic does affects the other, and I'd like to see us work together to give patients a more complete primary care experience, and I think that we can do that both with the help of the divisions but also just with the local strategies that we've developed. When I look at the future of healthcare change, I think we have to either develop more doctors and have more capacity that way, or we need to discover ways that we can focus on the most important healthcare issues and unfortunately let some other things go, because we just don't have the numbers at this point to continue in the same model, in the same way, with less doctors. And so my hope is that we can address both things, actually bring in more doctors and bring in more efficiencies.